Today we are here to talk about measurement of hypertension. How should we measure blood pressure? Should it be taken before meals, after meals, sitting, supine? So many questions come to our mind. Let's try to answer them. Let's begin with food. If we are trying to measure blood pressure and we want to diagnose hypertension, it's a good idea that we should measure blood pressure before meals. We should ensure that we have not ingested tea, coffee, alcohol, smoking for quite some time, at least half an hour before our blood pressure is measured. It's a good idea if we delay it further to 2 hours before we measure the blood pressure when we are specifically diagnosing hypertension, or we are trying to look into the effectiveness of the medicines if we are taking for the blood pressure. We should also not measure blood pressure as soon as we enter the clinic. We should have ample time with ourselves, sit in the sitting place, relax, be comfortable before entering the clinic of the doctor to have your blood pressure measured. Even in the clinic, when we are sitting in front of the doctor, let's convey ourselves, let's converse completely and spend some time before blood pressure is being measured. During the measurement of blood pressure, there should not be any conversation between the patient, doctor, or the attendants, because all these tend to increase the blood pressure readings falsely. Also, we should not stick to one particular time for measuring the blood pressure. We should take BP readings at various times of the day when we are having these readings. Ideally, when we are diagnosing hypertension or we are trying to understand the effectiveness of a particular medicine onto our cells for the blood pressure, we should have these readings in supine position, the sitting position, as well as the standing position, because these three readings will help us to differentiate between the postural hypotension which might occur. Cuff size is equally important. The cuff should be such that it should be able to cover the middle 2/3 of the upper arm, such that the lower portion as well as the upper portion beyond 2/3 of the cuff should remain free of the cuff. That means lower 1/6 as well as upper 1/6 of the arm should not have cuff, and it should be free while measuring blood pressure. Also, the brachial artery should be covered in such a way that the middle of the rubber part of the cuff should be covering the brachial artery. It's a good idea to measure blood pressure with a sphygmomanometer of mercury rather than any other machine, because they are still the most reliable not only for diagnosing as well as the follow-up of the hypertension. We must have at least 3 readings to diagnose hypertension and also to have the effectiveness of the medicine. These 3 readings which we are talking about should be at least 10 minutes apart. There should not be any clothing when measuring the blood pressure, and for that we must ensure that we have not rolled up the sleeves, rather than that particular arm in which we are measuring blood pressure should be free of all clothings, and that can be done only by putting off your shirt. Then only we can be able to have a proper BP measurement reading. While measuring blood pressure, we should have the convex upper part of the level of the mercury in the sphygmomanometer to get the correct reading. We should have good supported back when we are measuring the blood pressure of the individual. These were some of the few points which come to our mind when we are taking blood pressure to have good reading and have proper follow-up of the patient. With that, I would like to thank you all for your patient listening. Thank you so much.